Hi, Dr. Garima here, and yes, shooting a video after a long time. Well, anyways, there's a story behind it. We'll discuss that later. Right now, let's focus on the upcoming exam and four new questions that were asked in September 2024 paper. I could gather a lot of questions which I've already put in this mock 28, but there are four questions that I want to personally record for the benefit of all because they are very new. So let's start by solving them. Also, the articles related to each one of them I've already shared in the WhatsApp group for all my enrolled candidates. But here, when I'm discussing, you can yourself also just Google it up and read through it. So it's helpful for you all. For all the new candidates who are watching this video for the first time, we just discussed the past paper questions for Australian Dental Council exam written part 1, and I help you all to change the mindset by which you solve the question so that you arrive at the right answer in fast efficient manner, as there is a deadline for the exam and there are way too many questions and they are tricky questions. They are not simple questions. So let's start. Okay, so the first question that I want to solve is, which I've already solved before in another of my video in detail, but I'm just brushing through it for the benefit of all. A physically disabled girl enters your clinic with her dog. What will you do? Allow the dog in the room. In the room means your operatory room. Leave the dog outside but in direct view of the patient. Politely say that you cannot allow the dog inside. Leave the dog at the reception where it can be looked after, and allow the dog in the room with the muzzle. Muzzle is that, cone shaped thing which is worn around the neck of the animal so they cannot bite or try to pick up something else because it's preventing them to do that because it forms an area around their mouth. So if you don't know what is a muzzle, just Google it up and you'll know what that is. So so a detailed article regarding this we had downloaded, discussed, and I had shared. You can also go Google it up on the Australian Dental Council website and get it. But coming down to the answer, so two types of dogs will always be allowed inside your operatory. One is the assistant dog. What is an assistant dog? An assistant dog is the one which is helping the patient cope up, or it's been recommended by the patient's therapist that they can have. Now, in this scenario, it's a physically disabled girl and the dog is helping her in various ways. So it becomes an assistant dog. So an assistant dog will always be allowed inside the operatory. Another type of dog that will always be allowed will be a therapy dog. Now, what is a therapy dog? Some clinics in Australia are allowed to have dogs. So it's a clinic dog basically. The clinic takes care of the dog in all the respects, like the feeding, the vaccinations, cleaning, etc. They actually have to dedicate an assistant or so to take care of the dog. So that dog stays in the clinic, and whichever patient comes who would like to, take the dog and be comfortable around during the treatment, then that dog is allowed in the operatory room. So a therapy dog and an assistant dog are always inside the operatory room and you cannot say no to it, and there is no muzzle attached to either of them. Understood? So the option of leave the dog outside but in direct view, politely say you cannot allow, leave the dog at the reception where it will be looked after, are wrong. Okay? So the only answer correct, that is allow the dog in the room. That's a straight away forward correct answer. Since this question was asked, I'm pretty sure it can be asked again. And all the things that I've just discussed, a question can be made on that also and it can be asked. Okay? So remember this, mug it up. I know if you are one of those candidates who are appearing from the Asian countries or countries where you have never seen such a scenario, it's little difficult to understand. But yeah, when you're going to work in Australia, you have to follow the lifestyle out there and the things that go around. You should be well versed with it, so get well versed with it. Next question. This particular question I'm sure I've included already in one of my previous mocks. I mean, it's mock 28 now, like so many mocks and past paper questions we have now. So, yeah, but still, many candidates felt as if they have not seen this question before, so I am again solving it. Police comes to your clinic today to collect records of a patient whom you saw when he was a child 5 years ago. So now that patient basically is either a teenager or has just touched adulthood, and now what will you do? So take the child, that is who is an adult now, his consent, and then give the records to the police. Take consent of the parent of the patient and then give the records. Deny the records unless patient or parent consents. So basically you don't have either consent, so you'll tell the police, you know what, I cannot give you the record. Give the original record. Give the copy and keep original records, and no consent is required. Okay. See, whenever police comes, law is above anybody else. So straight away answer is you'll give a copy of the original records. You'll keep the original records with you, and no consent is required for that. क्या?
ये क्लीन को फिक्स कर दिया मैंने।